So anyway, do you want me to tell you what it bothers me?
Yep.
Okay.
It's okay.
The biggest issue I have is my left shoulder. It almost feels sometimes like it pops out, and then it'll, if I can get it back in, it's totally fine. But now it's back to where I can't put my arm behind my back again. Like I can't zip my dress at work. Basic things I should be able to do.
Okay. So tell me, can you lift it forward like this?
Not that far. So I can lift it forward, and I can only get
right
to here.
To about
Yeah, and then you can feel my
60
shoulder
degrees.
going up.
Like your
this
scapula.
way.
Yeah. And then go ahead and just take it behind you as far as you can.
Not very far.
Nobody can really go that far, but do you feel pain there?
It feels tight more than, it's not terrible pain. It's
And when you went
uncomfortable.
forward, where did you feel the pain?
Like right here.
You've never dislocated? Oh, no, you feel like it gets dislocated. So
Yeah,
let me
it
feel
not
this.
that often, but occasionally it'll feel like it's popped out.
So go ahead and like straddle the table for me, and I'm going to be on this side. Yeah. I know you have low back pain too, you said, right?
Just right here. I'm just stiff.
Okay. Now, when I push it this way, does that hurt?
It feels good.
Mind if I just see it, I guess?
You want me to take mine?
No, just to there. I know it's cold in here. When I push here, does it feel like it's going to come out of socket?
Mm-hmm.
I want you to relax your arm as much as you can, and I want you to tell me, does that still hurt when I do it?
Mm-hmm.
But that is about as far as we go.
Yeah.
So you know the exercises for frozen shoulder? Have they taught you that?
I think I Googled it.
Okay. And then when we go to the side, we have even
Yeah.
less. Okay. So the exercises for frozen shoulder, now come over here. You're going to take your hand and you're going to crawl up the wall, and then you stop where it hurts, right there, right? And you leave it there and you lean into the wall. Okay?
Because I feel like I'm like this.
Then lower it down a bit to where it's comfortable, and just push into it.
Okay.
Okay? That's how you break open adhesions yourself.
I actually just heard one.
Right? You hear it.
Yeah.
Crick.
Yeah. Yes.
Yeah, I'm going to manually do that for you.
At the extent.
Okay.
It's almost more than I can handle.
Okay, but it's not very pleasant though. Then
No,
the other
yeah.
thing is to take like a can of soup
Uh-huh.
or a weight, a dumbbell. Codman's exercise is just take it, swing it forward and back and forward and back and forward. And you're letting the shoulder drop. Okay, and then you take it in front of you. You let that weight of the pendulum
Okay.
pull at your shoulder, pull, 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 and you'll hear it crunch, and you'll hear it separate and all that. If it feels like it's going to come out of socket, obviously stop.
It just happens sometimes. And I don't know how to describe it.
That might have been the cause of the adhesive capsulitis to begin with.
Okay.
Bring it back. Does that hurt when I take you back like
No.
that? Okay.
This
now-
was tight.
Yeah, it is. It is. We're going to try to unglue that. Take a deep breath in. Just got to get it.
And I know you're like, I'm going to get that. I promise you. This is, you're not winning.
Anyway, I can. Now this side, we'll see. See, it just doesn't, it's never moved this way before. Okay. Any dizziness when I'm doing this?
No.
Okay. Yeah. That side's easy. Okay. And that was my ankles. That doesn't count. There we go. I always give myself like a little party dance in my head when that goes. How are you doing though?
Feels so good.
Okay. I'm just gonna see what it wants to do now. Let's see. See that? That just really.
I feel like I'm stopping it though.
It's well, it does. It can't. You know what I mean? Like it just can't. I'm sitting here ungluing that for you. Right here. It might. I think it's all it's got, but you know that's where I want to go. It's really there. It's just there. It moved. It just didn't do like what the left side did.
Yeah, the left side was.
And the right side just wants to stay like that. It's okay. It's better. Okay. So just let that rest.
I don't think about it for that second, but as soon as it's over, it's such a great feeling.
Oh yeah, when it can go.
Yeah, that.
But they're not adjusting you up there. they're adjusting you in your lower neck.
Yeah.
Because you don't bend there.
Yeah.
So they kind of are like, I'm not gonna do that. I've just done this thousands of times, so I'm just like, I know you can handle it. As long as you're not saying I'm dizzy or,
No.
you know what I mean? Because it's pretty high up near the all of those cranial nerves. So it's a more intense move than the lower neck. You know, having it that high is pretty intense, for lack of a better word. It's up there. So we're gonna do the toes, as you know, if you see in my videos.
It's the one thing that I don't know why it gives me the heebie-jeebies.
You want me to do it as fast as I can?
Yeah.
Okay, how about that?
I don't know why.
Just, it tells me where see that toe? That one, starting to get a little arthritis in there. Okay, this one right here, little toe. There we go, ungluing the ankle. There we go, good, good. How's the knee? How's this leg? Okay. Oh my goodness, your ankle. Any pain?
Just feels tight.
There goes part of it, yep. There we go.
Not at all.
Oh,
How
all right.
was your workout for today?
It's okay. This is my job. This is what I do. This is what I'm good at. Good. I'm gonna pull you a little bit off the table. Don't worry about it. Good. Perfect. Okay. Come on and sit up and face that way. Take your time. Take your time. Take your neck. Just look back a little bit. Anything there? Is that okay?
Mm-hmm.
Feel any better?
It feels a lot better. I couldn't get it back before.
Okay.
They just don't, like this one just feels like out. That's why I do this weird dance.
Hold on. Yeah, so we can't get this one down.
Mm-hmm.
Hold on. Let me have this hand here. So it doesn't want... I've got you. I've got you. Bend.
Do I feel like I'm taking over?
Yeah, you are. It's okay. Bend your elbow. I've got you. Let your arm relax. I got you. It's all right. Does it feel like it's going to pop out?
No, it just feels so tight. It's like not I don't know how to describe it. It feels like it just won't go that way.
The shoulder just won't lay down.
Yeah.
It just wants to stay high. You know what we can do is just place the arm here. Does that feel any
way
better? We can take the other arm too if you want. You can try to just tuck them under. That might be where we are right now. Okay? It's okay. We gotta start somewhere. I'm gonna go ahead and try to adjust this.
Okay.
Take a deep breath in. All the way out. Oh.
That worked well.
Well, that I didn't just try. That we succeeded there. Jeez.
That was a win.
Yeah, that was a good one. Now, I'm going to go for that shoulder, okay?
Mm-hmm.
But I'm going to come right in here. Does that hurt your shoulder or
No.
your neck?
No.
Okay, so take a deep breath in. All the way out. Perfect.
Oh, that was so good.
Perfect. And we're a little tight. There it is. You got it. Good.
Okay. Probably not helping holding my breath.
No, you're fine. You're fine. You almost need some air in there to do those.
Well, I
the
was holding a
diaphragm
lot
is
of
right
air,
there.
so-
You know what I mean?
Yeah.
It's right where you exhale. So if I were to tell you to exhale all the way, I'd hit your stomach. We don't want to do that. So a little bit of air is okay. And I'm going to pull. Okay, pull. It might feel like a pinch. Good, just one adhesion, I think. Yep, just one.
Oh, that's why you do that.
Yes, they're adhesions.
Oh, okay.
So if you're like, okay, she's got L3 to the knee going on here. So, yeah, and guess what popped? L3. Let's see. Let's go around the scapula. Let's see. You know, I don't know yet. I mean, I am going to get oil on your...
I don't care.
I'm going to come up on this side, though. There it goes. I'm sorry. It's okay. There we go. I'm gonna just, I got your arm. And then, there we go. That's it. Can tuck it back under if it feels better.
It feels actually okay the way.
Okay.
Whatever you did worked.
Well, we're releasing this big bone here. The crunches are normal. All normal. Here we go. I'm gonna come up into here.
Well,
Oops. So I'm going along this blade here. You know, I'm going in, and you do have quite a bit of congestion here. So if we release this, your shoulder gets to move a little more. Good. So we're gonna do this side now. I see the pins. I see where they went in. Is the pin still there?
yes.
Okay. Always ask if their medical hardware is still there before proceeding.
I would never do that again unless it was.
Oh, was the rehab quite hard?
I would have rather had therapy for a while to see.
Oh, to see if it would have done what it would have
Yeah.
done. I know.
Only the first 2 weeks are bad. Like the first,
Ah.
you go right after surgery, like the next day,
Mhm.
and they'll adjust it for you, and that's painful.
My dad believes everything comes from the neck.
Yeah, we're big BJ Palmer sympathizers.
If anybody even knows what that is.
Mm-hmm.
Okay, here we go. I'm gonna raise this leg up. Here we go. I'm gonna get it. No, bend your knee. And that's it. Here we go. Here we go. Cut through it. Done. And my butt's gonna be in the shot. Ouch, Max, sorry. Everybody blames me, but it's like, sorry, I gotta go this way.
The butt takes up the whole shot.
Poor patient, I'm sorry.
No,
Feel that? Ah!
it's why I'm here.
Well, this is what labor feels like. That was my
It's
point.
way worse. Oh,
This is like the beginnings of it.
I mean, all the miracle pieces, but that. Oh, I can't believe your body does that.
Yeah, I did it 4 times.
Oh, I just can't even.
No pain meds, just did it. Pain meds, we don't know her. Now, here's the scraping. I mean, are you okay with that?
Oh yeah, I'm totally.
The bruising and all that?
Oh, yeah.
You're not bruising too bad. I mean, it's there, but it's not. I wouldn't say you're the heaviest bruiser I've had today. I'd say it's like medium. Not too bad.
See, I didn't care if my clothes were ruined. I don't care if I bruised.
I mean, I really got oil all over your bra. I'm
yeah,
sorry.
I really don't care.
Okay, so what I'm gonna do? Give me this arm and just passively. Now I've got you.
Okay.
Like, I know it's gonna lock at some point, right there.
Yeah, did you hear it?
It's okay. That's the bone. It's all right. And here we go. It's gonna contract and come down. That's normal. Because I'm pushing it. It's coming down. All right. Well, no, that's my subject.
Yeah.
That ain't you. That me. Okay. Yeah, there we go.
That's the highest it's been in
There we go. We'll get it. We'll get it. It's a slow process ungluing a shoulder. It ain't quick. Bend the elbow. Bend it as much as it will go. Just to there then. That's all we'll do.
Okay.
Just relax it. That's another thing that you can do as an exercise is just like come up and leave it there like this.
Okay.
And then go a little more. You know, prop it. Pull this, make sure you pull the scapula down.
Okay.
Does that kind of make sense?
Yeah, it does.
You know, you're trying to slowly.
I think the look you see me
unglue
doing,
it.
it's like, yeah, I don't know if I'm going to do that, but.
Oh, is that the look? Is that what
That's the look that you. That's the look you're seeing, but I'm trying to pretend like I'll do it.
Like, lay
I'm
in
going to
bed.
start with the swings and the wall. This part. All right, I'm going to lay in bed. I will try it.
Make sure this is low. Don't, because that's cheating.
Okay.
You know, low, and then you sit there and you prop it up on a pillow until eventually you're here.
Okay.
There you go. You doing it? If you do the Codman exercises, and
Yeah.
you'll be fine. I'm just sitting here and fiddling with it, okay? Because we can lay your arm down to here.
It's way better.
Yeah, I couldn't even get you here, okay?
And I will
But
not
all
doing
I'm
this
doing
either.
is just fiddling with this, fiddling with your elbow. It's in her elbow, it's in her wrist, it's in her fingers. And I don't want to make you too sore, but I, ice this.
Okay.
Because your arm is now flat with the table.
I know,
Yeah, it didn't happen by magic.
No.
Okay.
And it didn't happen in 5 minutes.
No. So this, but what we want to do is get that so you can internally rotate down here. That's the next step.
Okay.
But we got it to here. Okay, because we couldn't even get it,
Not at all.
But we're all the way to here now.
Without me shrugging.
And without you screaming either.
Yeah.
Because I don't like doing that to people. You have to keep that up and don't be afraid of it. I know it hurts, but you can even have somebody stabilize it and just keep pushing that up.
Okay.
But let's try it. Come on, and you can put the shirt back on.
I don't know. It feels so much better.
Well, here's the trick. Put it behind you.
Okay. Well,
It's still about the same.
no, I
Right?
couldn't get it back at all. At all.
Okay.
It didn't go past here. So you did a lot.
Okay, so that feels comfortable then. Just
Yes,
put it
it's
back
not. Well, first off, like I said, I'm not turning I usually put my shoulders up.
here. And then just. Okay.
I think it's a lot better.
Yeah. So it is adhesive capsulitis, and we just got to slowly break it down until it goes all the way up.
See, I don't need an MRI.
I mean, if the rule of thumb is if nothing changes, if we get stuck somewhere and nothing changes, then we go get an MRI.
I don't want a quick fix, I think.
This is not a quick fix.
No, not what you're doing, but
no.
it's.
But this is going to take time as well.
Yeah,
But
it's no surgery. It's
true. You're not being put under. There's risks of
Right.
being put under.
well, I just think it. I don't know. I'm not a big surgeon.
Well,
I
we've
mean,
already
a
had
fan.
that trauma with that other side. Head back, look back. I just fixed your neck. Yeah, we keep that. That's all that is. There it goes, a little bit. That's all I need. I don't get these guys. I don't touch these guys. I lock your leg in. Now does that hurt? Does
No.
it hurt? I'll stop. You
It
understand?
doesn't. It yeah.
Am I hurting your shoulder?
No.
And that's all. Wait. Does that hurt? I'm really
No.
taking you. There it is.
It doesn't hurt. It's stiff. It's like you doing a split and me pushing you further. That's how it feels. It's not painful. It's stiff, tight,
But it needs
and
that
it feels
motion.
good. Yes.
It needs that mobility. See, the adjustment takes you there, and pushes you briefly past that point. Not enough to rip it, just to spring load it. That's what you're doing to the joint. You're just real quick. And
well,
that
the
gives,
joint is saying, please, please, please do it. And then it feels so much better. I feel so much better.
You're fine. I don't adjust the low back. There are certain regions I don't adjust, and there's a reason for that. I'm teaching you quite a bit here, but that's what it is. Okay, press out against my arms. All right. 4, 3, 2, 1. I want to warn you, this is the third joint of the pelvis. It's on the front. Okay. And then you're going to squeeze my hand. Squeeze. That's all that is. It's good. No problems there. Take your time and come on up. Okay. You okay?
I feel great.
I'm just checking you. Go ahead and stand up for me. Good. Well, that looks much better.
It feels much better.
Okay. Sorry, I'm looking all over. Yeah, the shoulder is set back now. Okay. I did my job. I'm looking here. I'm like, okay. Fine.
We worked it.
Yeah.
I mean, I feel really good.
Okay, and we'll just stop there. Because I want you to go home and rest that shoulder, ice it
And
if
ice
you want
it.
to.
Yeah.
Yes, because I just broke down quite a bit there. If you go out and then turn.
Yeah.
You see what I'm saying? That's
Yeah.
where I took you today, was there. Eventually we want to go up. But without the scapularizing.
Mhm.
Okay. That's all.
It feels, you have no idea. I mean, it feels so much better.
Well then enjoy it. Enjoy it. Enjoy it. That's what I tell myself when I get adjusted. I'm like, oh, thank you.
Well, and I know, I must make a face like you're hurting. It doesn't hurt. I don't know how to explain it. It feels really
I check
good
in on you at
all the time.
because I'm usually not looking at you and I'm feeling for you know what I'm saying? And when I feel any kind of vibration, you okay?
Yeah. No, I mean, really, I could
That's
kiss
me.
you because it's so much better.
Oh,
And I know
poor
it's late,
thing.
and I know you do this all day.
It's okay.